afternoon. We want to thank everyone for joining us here today. We just convened a special meeting in the Regional Task Force on the Homeless to talk about the specific action steps and items that each of our entities and jurisdictions are taking in a very coordinated way to try and address the impacts of COVID-19 on the homeless population. As we experience and walk through the next days, next weeks, next months, we have a particular focus on addressing the impacts for vulnerable populations and communities. Families and individuals experiencing homelessness are full members of our community. The situation with coronavirus is very fluid, and we remain vigilant, but more importantly, we remain very proactive and aggressive about protecting populations, just as we would do with any of our family members, with any of our friends, or with anyone else throughout San Diego County. Individuals experiencing homelessness deserve the same care, compassion, and attention as everyone. And we are standing today as a city, as a county, as homeless providers, as the Regional Task Force on Homeless, and a unified and coordinated effort to make sure that we are protecting these vulnerable populations. We want San Diegans to know that our region is working together and coordinated to manage the spread of COVID-19 and to do everything possible to tackle the challenges and issues. We have outlined a number of steps that the county has taken. We've outlined a number of steps that the city has taken, a number of steps that RTFH is helping coordinate, along with all of our nonprofit providers who are there. And we're grateful to have with us the chair of the Regional Task Force on Homeless, Councilmember Chris Ward, the mayor of San Diego, Tamara Kohler, the chief executive officer of the Regional Task Force on Homeless, along with a few homeless providers, and Dr. Nikki Fentides, our chief medical officer at the County of San Diego. Just quickly to begin, the County of San Diego, in partnership with cities and with other jurisdictions, has already been installing and setting up hand washing stations throughout the jurisdictions, the majority in the city of San Diego, but in other cities as well. We are also getting requests from other entities such as MTS to have them at trolley stops, and we will continue to do that. We are sending homeless outreach teams to work with the unsheltered populations, and we'll be in the process of distributing hygiene kits, which include hand sanitizers, information cards on what they should do, the symptoms, the signs, along with, in the event they feel like they're experiencing it, we're encouraging them to contact their healthcare provider, or if they don't have one, to call 211, which is set up and ready to help address that. The sanitation kits also include water, soap, hand sanitizer, tissues, and hand wipes. We are continuing to have public health nurses go into shelters to work with our shelter providers, along with Be on the Foot teams. And we are working very aggressively to identify housing and shelter locations for individuals who might be a person under investigation or who might test positive that don't have a location to go. The reality is individuals should not go to the hospital unless you rise to a level of severity that requires hospitalization. And so we are aware and we are providing capacity to be able to provide options for individuals who may be unsheltered or who may be in a congregate care setting, who are a person under investigation or potentially a positive test, so that we can get them in an isolated location and ensure that they get humane treatment at the appropriate level without overwhelming our systems. Again, the city has a number of steps they are taking. I will let them work with. Regional Task Force on Homeless has a number of steps that they are taking, but we are all in daily communication, in daily coordination, and in daily action to ask ourselves, what else might we do? What are other options? What are other things that are needed? And so I think today's meeting was very productive. We've got a very receptive response from the homeless providers who appreciate the coordinated, the proactive, and the aggressive efforts that we are all taking. And before we turn it over to the next speakers, I will just say, as a region, we should expect and prepare ourselves that this situation will get worse before it gets better. The reality is, when you look at what's happening across the country and across the world, this is something that we are going to do everything we possibly can to lessen the impacts, to mitigate the dangers, and to provide all of the care that is within our capacity to do to help protect the residents of San Diego County. Next up, I'd like to introduce the chair of the Regional Task Force on Homeless. I appreciate Chris Ward convening this meeting. I appreciate the RTF and everything they're doing. So we'd like to invite Councilmember Chris Ward to make a few remarks.
Thank you, Supervisor Fletcher. Thank you for everybody for being here. We just had a 90-minute meeting with the Regional Task Force on the Homeless Board of Directors, as well as a number of service providers. The RTFH is a collection of about 31 service providers, funders, educators, healthcare specialists, others that are working daily and have been so for years to be able to try to manage all of our response and our programs around homelessness and reducing our unsheltered numbers. And of course, the crisis that we have today responding to COVID-19 really required us all to come together to make sure that we're operating off of the same set of facts, that we have all the information at hand so that they can be able to take that out into the field, out into the shelters, out into their programs, and really make sure that our homeless neighbors are well protected and guarded as much as the general population to be able to respond to any community-acquired cases that might come down the road. We really appreciated the really level setting that we got from county officials, the technical assistance that we've had through HUD, and the leadership that our CEO from Tamara Kohler has been able to provide because of that special and unique relationships that she has. This has positioned San Diego as a community to actually be the first to access HUD-related assistance with regard to COVID-19 response. So with that, again, Supervisor Fletcher, we're really grateful for the county and the coordinated response to be able to host this meeting here today. This is probably the first of several meetings as the situation, the dynamic situation, will continue to evolve, and we're going to continue to stay united as one front between the city, the county, and the RTFH to make sure we're doing all that we can and should do to address the health concerns in our unsheltered population. Thank you.
Thank you, Councilmember Ward. And it's not just the city of San Diego. We are working with every city in our jurisdiction who are there. And I appreciate the role RTFH is playing. And I also want to say I appreciate the role the city of San Diego is playing. As we confront this public health challenge, there is zero daylight between the efforts of the city of San Diego and the county of San Diego, and in these instances, the Regional Task Force on Homeless. We are in daily communication. We are in daily coordination. If the city has a suggestion for the county, then we do it. If the county has a suggestion for the city, then they're doing it. But we are absolutely working together in a proactive and coordinated effort to make sure we're doing everything. And so I appreciate the mayor. I appreciate his constant communication. I appreciate his engagement. And so we appreciate him being here today. And so, Mayor, we'd like to tell you thank you for everything you're doing at the city. And podium chairs.
Thank you, Supervisor. And thank you, Councilmember Ward, as well. This is a coordinated and unified effort with one goal. How are we doing the planning, the preparation to help people? And I can't stress that enough in terms of preparation, particularly for those among us that are the most vulnerable. That's what today's special meeting of the Regional Task Force was all about. And so I want to thank again the county, the Regional Task Force. Let me just reinforce something that Supervisor Fletcher just said. We are united. We are united in one approach. And how quickly we have, I think, put out resources to our bridge shelters, out to our communities. Today was about information, factual information. To have Dr. Nick here, this is the most coordinated effort that I have seen. Look, as we know, things are likely to change, and it's how we are prepared and how we plan for it. It's about being vigilant. It's about looking at the best practices that not only we have been establishing in our bridge shelters, but I think as Tamara can attest to, looking at other parts of the country, again, to get that information out, get those testing out. I can't say enough about the county and what we're moving forward with our public health nurses that are going to be at all of our bridge shelters in terms of education, in terms of screening. It is indeed a constant flow of information and a constant flow of help and assistance. And as I said before, we're really focusing on those that are the most vulnerable, that need our help, particularly in our bridge shelters and others. Reinforcing proper sanitation, proper hygiene. You cannot have enough education on this, and so the fact that we had just about a 2-hour meeting with all of our providers, being able to ask those questions, to get the most up-to-date information, and really to stress that we are moving forward as one region. That's how we're going to achieve our best success. You heard a little bit about the 66 hand washing stations throughout the city of San Diego. Additional hand washing stations are being available by the county. The county has moved extraordinarily quickly on all of these requests. We're also, of course, increased cleaning at all of our shelter facilities across the board in San Diego. That education of staff is incredibly important for our employees to ensure that our employees in our shelters are taking the proper precautions and protections as well. And as I mentioned earlier, the deployment of the county, the public health nurses, I think is going to be incredibly important. These nurses are going to be on site at our shelters. That's the type of real-time information we need, the screenings we need. I think it's going to make a huge difference. And so we're going to continue to work on this every single day. That's why today's focus particularly was those who suffer from underlying health conditions, and as I said, in an aging population that we see in our shelters. And so taking quick, coordinated action, I think, is going to be incredibly important. The bottom line is that the City of San Diego, the County of San Diego, remain on high alert, remain on constant communication, constant coordination with our healthcare professionals. Dr. Nick is here, as I think many of you are familiar with. And look, we're going to continue to urge all San Diegans to follow the advice of common sense hygiene recommendations, follow the advice of our county public health professionals and officials. I want to thank all of our partners who came together today. This continued discussion, this continued education, dissemination of factual information makes a huge difference. And as Councilmember Ward said and Supervisor Fletcher, this is not just a daily occurrence, it's multiple times a day. That's going to make a huge difference as we try to help those that are, as I said, the least fortunate among us. So thank you, Supervisor.
Thank you. Thank you, Mayor. Next up, I want to invite Tamara Kohler. The meeting we had today, as the Mayor mentioned, was quite long. It was a working meeting. It was a granular meeting. We got down into things about providers having continuity of operations in the event that a percentage of their workforce is not available to work. It was issues around transportation and housing and best practices. And Tamara Kohler brought a wealth of information and knowledge and best practices, particularly around those who are unsheltered, reviewing HUD technical assistance and guidance, and I think it was very informative to the group. And so, Tamara, we appreciate everything the RTFH is doing and are grateful to have you in this role at this time. So, please.
Just a little shorter. I want to share that not only as we are preparing and we are using the best practices available to us, everyone on the same page, sharing this coordinated and collective approach, it is also one of compassion. It is one of understanding what the needs are of individuals who do not have a home tonight, that they are informed in an equitable way, that it is clear and concise, that it is appropriate to their needs. We had, as you have heard, everyone in the room who really works with and serves this population. And having us all on the same page about how we will move and act when the time is appropriate is one of those key points in time that, as you have heard, there is no daylight between these organizations, not only from government, but from the providers as well. We had transportation in the room, the hospital association, education, law enforcement, people with lived experience who can help guide this work. And I think that it is important as we prepare that we are preparing to act, and when we act, it will be with the right level of response and compassion to be able to meet the needs of this incredibly vulnerable population. We need to be judicious in how we are going about that, and that is our intent. The Regional Task Force has the responsibility of regional support and technical assistance. As was mentioned, we've been able to get significant support from a federal level due to our relationships there, and we will continue to bring the practices across the nation that we hear are working to San Diego to put into action immediately as the need presents itself. Thank you.
Thank you, Tamara. Last up, I want to invite Dr. Nick Ifantidis, our Chief Medical Officer. All of the actions that we're taking are guided by medicine, by science, by proactive approaches to doing everything we can. And so we appreciate his engagement. At the county, we've identified 8 separate sectors that we're engaging uniquely, whether they be seniors, our medical population, the business community, or in this case, those of the unsheltered. What's guiding each of those actions is everything that we know in a very dynamic and fluid and evolving situation for what we can do to have the greatest impact the most positive way. And so I appreciate Dr. Nick, and I want to ask him to make a few remarks about the challenges and the opportunities and everything we're doing around helping the unsheltered. Dr. Ifantidis?
Thank you so much, Supervisor Fletcher. I have no interest in repeating anything that you have already heard, but if I may, just a few important points. It is important to recall and to again be reminded that up until this point in time, we do not have any documented evidence of local transmission in our community. But out of our posture of love, out of our posture of protective passion, we are doing everything that we can in order to get ahead of this rather than behind. The other thing I want to say quickly, viruses know no homes. Viruses know no zip codes. Viruses allow certain challenges that we are facing as a region to be a challenge that we all need to address collectively. Folks, as a steward of our region's health, with everybody up here, yes, the focus at this moment is on the homeless, but our support, our proactive posture of preventing the preventable among this population is beneficial to our entire community. I could unpack that a lot more, but it relates to the issue of making sure that people are getting the right care at the right time, in the right manner, in the right location. Having said that, I also want to quickly remind us all, this virus disproportionately affects people. It is influenced, its severity, by age, and it is influenced tremendously in terms of how severe the impact could be by the underlying condition of those that it infects. As such, this is a very high-risk, vulnerable population that we are eager to support, protect, and promote. Lastly, as has already been said, there is a tremendous amount of initiative going on in collaboration with the City of San Diego, all of our cities, and the county, with particular focus, as has been mentioned, on efforts in the ground, on site, at the established facilities that are housing these individuals. In addition, efforts that are underway and will be further underway with regard to individuals who are unsheltered. One last time, this virus is not a homeless issue. It is a regional one. Thank you very much.
Thank you, Dr. Nick, and we will continue to provide regular updates on the situation as we move forward and ensure that we're doing that. We've just come out of a very long meeting, and we have a number of folks that have to get back to their jobs, but we'd be happy to take a few questions. I would ask the best of your ability if you could focus those in on efforts around homelessness. We're happy to take a few briefly. Well, what we're looking at doing is we are looking at housing options that we know that we need to have available that could be for any individual who doesn't have a home, who needs to be quarantined and needs to be there. And so that could take the option of motel-type settings. It could take the option of government buildings or facilities that could be converted into that. We could move forward with setting up tents in different areas, and so we know that this is an issue we have to address as we are speaking. Over the last many days, we've been moving rapidly to get that capacity up and running.
How are you going to connect individuals who may be living on the street with testing to determine if they are infected?
Nick, you want to talk about your teams?
Go for your team.
Sure.
Very forward.
The question is with regard to testing. The relationship that we are still completely dependent on is the established providers that are serving this community medically. The intention, that being facilities like federally qualified health centers, Family Health Centers of San Diego, a host of community partners that are part of our region's safety net that have this population as part of their focus and priority. The county, at this point in time, has no concerns with regard to testing capacity, but we are eager for us to continue being good stewards of those tests, and as such, ordering those tests need to be done in coordination with established providers. If individuals don't have established providers at this point, we still always talk about 211. There are foot teams, there are other public health efforts underway to connect them, and some of that coordination is exactly the function that our public health nurses will be providing on site in the various facilities. Repeat the question, please. There are not test kits, if you're asking, the questions are those test kits available now. Those test kits are not at site at the facilities themselves. The capacity of being able to appropriately collect the samples and have them brought to the lab are in place. And I will say that there is a little bit of a update of posture and routine with the county up until recently with CDC guidance based on even more limited capacity for testing. There was an approval process involved in that sequence. The county is no longer going to be requiring that approval. It is up to the judgment of the healthcare providers serving those individuals whether or not they will order and obtain those tests. The county's responsibility and the loops that have been closed have to do with regard to ensuring that the positive results, whether they be done at commercial labs, whether they be done at health system labs, and there are several health systems in our community that are on the precipice, if not already able to do that testing, that the positive tests come back to us immediately if they are from labs outside of the counties, and then the appropriate contact tracing routine process can be promptly initiated.
We'll do one more. Last question, Jamie.
Let me clarify. The question was just confirming there is no contaminated, i.e. infected person. What I said, and this is very important to be aware of, there is not any evidence yet in our region that we have what we call community-based transmission. A couple evenings ago, we held a specialized press conference of the first non-evacuee positive test result in our region, but that person had travel history that allows us to put that in the category of a travel-related case rather than a community-acquired case in the absence of any of that risk. Thank you.
Great. Thank you all very much for being here. Our normal media channels will all be available to field any additional questions and comments, and we appreciate being everyone here. Thank you.